Welcome to Hudson Health. My name is Dr. E.J. Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a part of RWJBarnabas Health. I'm here today with my co-host, Dr. Angel Lazo.
Thank you, Dr. Akunyili. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place Internal Medicine. And today we're actually going to talk about heart health. Since February is Heart Health Month, and we're going to be bringing awareness to heart health during this segment. So today's segment is going to be about heart health.
It is, and you have the red tie for it, Dr.
Absolutely.
Lazo. So RWJBarnabas Health has an impressive array of cardiac, thoracic, heart services for all ages, really. And it's important we bring awareness to this, as heart disease is one of the leading causes of death in the United States, as we all know.
Absolutely. And the medical center being the only full hospital, health hospital in the county. It's very important. Actually, we're going to talk to our guests, and we're going to talk about all the innovative things and the multidisciplinary approach that RWJBarnabas Health, and specific at the medical center, has for cardiology to be able to offer to our patients in Hudson County.
That is correct. And today we'll be talking to one of our guests, truly one of my favorite people, Dr. Michael Benz.
Absolutely, my favorite as well. So we're going to go to break now, and we'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Welcome back to Hudson Health. In this month in February, we're actually celebrating Heart Month. And as part of Heart Month, we're going to focus actually on heart health and so on and so forth. So talk to me about heart health.
So, you know, I think I'm an emergency physician. I'm also Chief Medical Officer at Jersey City Medical Center. And it's interesting, you know, we talk about the heart, but it's not really just this isolated entity. Heart disease is the leading killer of men and women in the United States. It's interesting because we need to sort of define how it affects everybody of all ages. And part of this is to learn how RWJBarnabas has all the infrastructure to help us take care of our hearts from at all ages.
And especially Jersey City Medical Center, because Jersey City Medical Center being the only real full-service heart hospital in Hudson County. A lot of patients are not aware that it's not just, you know, coronary artery disease, there's structural heart disease, there's heart failure, you know, there's issues with, you know, conduction problems or rhythm of your heart and so on and so forth. And this is the beauty of RWJBarnabas Health, encompassing everything from open heart surgery, and some of the most innovative and up-to-date academic practices are actually part of Robert Wood Johnson, which is very, very exciting.
I agree. I think we have an impressive array of cardiologists, as you mentioned, to take care of every part of your heart disease, and not just cardiology services, thoracic and vascular services, really the state of the art for Hudson County residents, that they don't need to go anywhere else this month.
Now, for me, because I do primary care, you know, heart health for me is actually very important because it goes by prevalence of disease. And again, the most common cause of death and morbidity really is heart disease. But it's not just coronary artery disease, you know, as we had spoken. So the question becomes for my patient, for example, what does heart health for me mean? In other words, if I'm doing preventive services for heart health for my patient, what does that mean? And for me, again, it's involving all the risk factors that are associated with cardiovascular disease. And again, cardiovascular disease is coronary artery disease that affects both myocardial infarction and stroke as the leading cause of death. But it's not just the only issue as far as the heart is concerned. And for me, for preventive medicine, for example, my risk starts for my patients that are male at about the age of 45 and women roughly at about the age of 50 or 55, depending on whether they're menopausal or not. And again, we already know the risk factors. And again, even though we've studied, you know, just about everything you could possibly study, cholesterol and so on and so forth, all the studies that have been done over the last 10 years already include the standard of care as far as cardiology. So that includes aspirin, that includes blood pressure control with medication, lipid control, diet glycemic control, et cetera, et cetera. So the question becomes, from a primary care point of view, how do you make that introduction to the patient? And this is exactly how I do it with my patients. I discuss with them the risk factors and at what point they need to go see the actual doctor that specializes in your heart. Okay, but again, it depends on what kind of problems they basically have. So we're really looking forward to talking to Dr. Michael Benz, who's a very, very interesting cardiologist. I don't know if you're aware, but he's actually board certified in actually 7 disciplines actually in cardiology.
I did not know that, but somehow
7.
I'm not surprised.
Absolutely.
Dr. Benz is phenomenal. In my case, by the time patients come to me in the emergency room, they're already showing symptoms of heart disease, but to be able to refer patients after emergency room visit to a cardiologist, and he's been one of our best, brightest, and really good person that's loved by his patients. I do want to say that it's important for us, and we talked about this last time, right? All this is great, but really what makes the system special is the ability to have access for patients to come in and understand those risk factors. And we also do things like helping people with diet and preventing heart disease so they don't need the services in the first place.
Yeah, in fact, in our last segment, we actually had spoken about our new location actually in Hoboken, where the full array of the cardiovascular services are actually going to be offered there as well. So very excited about talking to Dr. Benz and see what he has going on and see if he can catch us up to date with some of the new innovative things that RWJBarnabas Health and Jersey City Medical Center is actually doing.
Absolutely. Talking of innovative, we would like to hear about the TAVR program. I wouldn't let too much out of the bag because I want Dr. Benz to tell us about it. So looking forward to it.
Well, I'll tell you what, why don't we go to break?
Yes.
And we'll come right back with Dr. Benz.
Absolutely.
Okay, we'll be right back.
See you soon.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just 1 pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, everyone, and welcome back to Hudson Health. In this segment, we're actually going to be talking about heart health since February is actually Heart Health Month in America. And my name is Dr. Angel Lazo. I'm with Robert Wood Johnson Barnabas Health, and I'm in the Exchange Place as a primary care physician. And I have my co-host.
Hi, I'm Dr. E.J. Akunyili. I'm an emergency physician and chief medical officer at Jersey City Medical Center, a member of the Robert Wood Johnson Barnabas Health family.
So, Dr. Michael Benz, what an honor to have you here today. So tell us a little bit about you, some of your credentials, and so on and so forth.
Thank you, Angel. I'm an interventional cardiologist. I also do a lot of structural heart procedures and general cardiology. I'm affiliated with Barnabas Health, Robert Wood Johnson. I'm very honored to be a part of the system. I have to thank Angel on this occasion. He was instrumental in me developing my career. I underwent a lot of training in cardiology, multiple board certifications. Cardiology is
7.
Yeah. Cardiology is changing a lot. We have a lot of breakthrough technologies. It's amazing as on the other side, the computer science is developing, medical side also, a lot of huge developments. We want to bring all these new developments, new technologies to our patients in Hudson County. This kind of procedures being done only in major centers in New York City and Ivy Leagues, thanks to Robert Wood Johnson and Barnabas Health. With their help, we started our structural heart program. Structural heart program is much more than interventional cardiology. We do a lot of procedures with minimally invasive techniques. In the past, it's like a breakthrough technology. We cannot imagine that we can put a new valve in the heart without open heart surgery that we call TAVR. TAVR stands for transcatheter aortic valve replacement. if you go back to before 2012, the only way to put a new valve is open heart surgery, general anesthesia. Patient has to be in the hospital for like 7 days, like 3 to 4 months recovery, and it's a very big surgery. That's why we were not offering valve replacement for older patients. If somebody, I still remember I started my practice in 2006 when the patients came to me with severe aortic stenosis, which is the most important valve in the heart. The valve opens and closes almost 100,000 times a day. Wow. Lot of wear and tear. And if somebody came to me, 75-year-old with a severe AS, even though their lifestyle is good, we could not offer the valve replacement. And because unfortunately this is a mechanical problem, medications don't work, and it's a lethal condition. It's said if the valve, if somebody has a severe aortic stenosis, it's almost equal to stage 4 metastatic cancer. Wow. And patient died within 2 to 3 years. Yeah. Now, thank God with this new technology, we can give this valve. It's a 1-hour procedure. Patients will be able to walk after 4 to 6 hours. They go home next day morning, no surgery, and they can do whatever they want after 1 week. It's amazing. And that we are doing in our own Jersey City Medical Center. From Hudson County, now they don't need to go to New York City or other counties.
No, that's incredible, Mike. That's just unbelievable, what they're able to offer here in Hudson County. But it's not just the care, it's also the academic component, because a lot of this is happening, the ability to do TAVRs and so on and so forth. This has a lot to do with the academic practices. Correct. And especially RWJBarnabas Health is the leading academic practices actually in the state of New York. But what does heart health mean to you as a cardiologist? Because we're doing awareness for heart health. Correct. We're definitely going to talk about the TAVRs and so on and so forth, probably a little bit more extensive. But as a cardiologist, what does heart health mean to you?
Yeah, I think it's a very important question. February is the Heart Health Month. In spite of all these developments, heart is still the leading killer, of the human population. So it's sad. But I think, heart health means to keep the heart healthy so that we don't need to go for the procedures. Prevention is the big thing. How do we prevent? Common things like stopping smoking, eating healthy, exercise, avoiding stress, sleeping enough time, common things. And most important thing also, a lot of patients don't follow up with their doctors because they think they are healthy. I recommend everybody from age 35 and above see their primary doctors because these problems can be detected. So heart health generally means, in my opinion, prevention of the heart disease, keeping the heart healthy so that we don't even need to go for the procedures. There's still we have a lot of patients undertreated, particularly in women population, particularly in Hispanic population, black population. I think the American Heart Association has decided that February is the Heart Health Month so that we can promote and we can advertise about the heart health, so there is more awareness.
So it's interesting you mentioned that because we talked in a prior segment about women's health and definitely other populations that don't really get the attention they need. But thanks to people like you and Heart Health Month, we're talking about getting everybody healthy. What other misconceptions do you see people have about heart health?
A lot of times what happens is we are, the way human mind drives is unless you have a pain, unless you have some suffering, you don't think it's necessary to see a doctor. Yeah. Particularly, I notice in my own patients, the wives, they take care of their husbands so well. They come with the husbands. They bring them to me for their checkup, but they never get themselves checked. Yeah. So they think that they're very busy because they have to take care of their husband, they have to take care of their children. So I think that misconception should go. I think everybody's, because as a woman, she's the leader of the family. She runs the whole family. Her health is more important. Yeah. So I think I tell everybody, for all the men, make sure that your wives or your sisters, moms, they go to their cardiologist or primary care doctor, then have their heart checked.
Yes, primary care, heart health is actually front and center for us. And again, this is the reason we do a lot of the preventive things and the referrals to cardiology that are appropriate. But Mike, unfortunately, we're going to have to go to break, but we're going to be right back and talk to Michael Benz a little bit more. We're going to get a little bit more in depth about the TAVR programs over there, the structural heart program at the medical center.
Thank you, Angel.
Thank you. We'll be right back.
I've got cancer. We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJBarnabas Health. I have with me today my co-host, Dr. Angel Lazo.
Hi, I'm Dr. Angel Lazo with RWJBarnabas Health at Exchange Place Internal Medicine.
And we have with us Dr. Michael Benz, our cardiologist.
I'm Dr. Michael Benz. I'm a structural and interventional cardiologist affiliated with Jersey City Medical Center, Barnabas Health.
Welcome back to the segment. We had an interesting conversation in the last segment. So I just wanted to start, Dr. Benz. Tell us why you think RWJBarnabas is the leader in structural heart disease treatment in Hudson County and regionally.
Absolutely. Robert Wood Johnson Health System, Barnabas Health and Rutgers. I think it is the largest health system in the country. They have 22 hospitals. In the hospital system, everything can be done from A to Z, particularly coming to heart, like starting from preventative cardiology all the way up to heart transplantation. They have like 5 to 6 major hospitals. I think the system is doing a huge service to the entire state. They're not only just to management, but it's also very big academic center. Lot of research trials are being done. And we are very fortunate to have that kind of large system in our state. And if you look at any numbers, for example, my specialty is structural heart disease. They do the highest number of cases. The system does highest number of cases in the state, probably in the country. So when we do this highest volume with all these super trained cardiologists, outcomes are going to be better. Yeah. And also, even if you are in a remote place in the state, because they are affiliated with the Robert Wood Johnson Barnabas Health, they can be brought to their tertiary facilities. Yeah. And there is a lot of continuity of the care because of the EHR. So whatever is, correct, even the patient comes to the tertiary care facility, we take care of the patient, and they can see what we did. So yeah, it's a blessing.
Yeah. No, and it's even much more than that, Mike, because again, the focus really is, as far as Robert Wood Johnson Barnabas Health, on the academic practices, and cardiology being the most prevalent disease as far as heart disease and death overall, globally, including the United States. And Robert Wood Johnson Jersey City Medical Center offers the full gamut of care, as you said. Now, structural heart disease is something new for a lot of our patients. They don't understand what the structural heart program is. For me, as a doctor, I understand it. And structural heart disease, for me, is, valvular heart disease. And again, this is where we're going to talk specifically about the TAVRs. But you also got the microclips, you got the Watchman, there's a lot of innovation going on. And again, even though we're in academic practices, we do academic medicine, the academic healthcare management is one of the specialties from Robert Wood Johnson Barnabas Health. So, and I have to congratulate you, because I understand you've actually done over 100 TAVRs.
Correct.
Tell us about that.
It's great. Actually, we started this program, in Jersey City Medical Center. Before, there was no hospital offering these advanced heart procedures in Hudson County. Patients had to go to New York City, other counties. It's a lot of inconvenience, particularly for big heart procedures for the patients. Thanks to the administration, they said our patient don't need to go anywhere. We started this program in September 2021. So far, we did 109 cases. The most important thing is not how many procedures we did. We have 0 mortality. Wow. National standard is up to 2 to 3% is acceptable. That's the national average. We have done 109 cases with 0 mortality. That's a huge accomplishment for our system. That means how good we are. Right? And also complications. We look at whenever we do these advanced procedures, there are complications involved like a stroke, bleeding, vascular problems. Our complication rate is much, much less compared to national standard. So that's the thing. That means we are not only doing the procedure, we are doing the best possible way. So our Hudson County patient should be proud of.
Yes.
And what is structural heart disease? Very important because science is advancing. So our goal is to make sure that patients don't need to go to big open heart surgeries. Right? Can we do that in a minimally invasive way? So that's all structural heart disease. So that means we can put new valves, we can repair the valves, we can fix the holes. So many things we can do without open heart surgery, which is really a good thing for the humankind. So now in the medical center, now we can do what we call TAVR. TAVR stands for transcatheter aortic valve replacement. When the patients have aortic stenosis, particularly 65 and above, you don't need to go for open heart surgery anymore. Unless you have other reason to undergo open heart surgery. All the patients, if they have this huge valve problem, come to us, or if you are closer to different hospitals, you can go there, and this can be done. It's a 1-hour procedure, and you go home next day morning. Actually, it's very interesting. Some of the hospitals in the country, like Cleveland Clinic, they're trying to discharge the patient on the same day. One day we will do that also. So other things like we call mitral valve. Mitral valve, a lot of patients, they develop leakage. We call regurgitation. They develop heart failure, and patients die because of that. And they are always breathing hard. Those patients, before we had to open their chest, put a new valve. Not anymore. We can actually clip. We can put the clips, reduce the regurgitation, and their quality of life gets better. They live longer.
Dr. Benz, we have so many more questions to ask you, but we have to take a break. We'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place as an internal medicine. I'm your co-host here with Dr.
Well, hi, I'm Dr. E.J. Akunyili. I'm the Chief Medical Officer at Jersey City Medical Center, a part of the RWJBarnabas Health family.
I'm Dr. Michael Benz, structural and interventional cardiologist affiliated with Jersey City Medical Center, Barnabas Health.
So welcome back again, Mike, for this second segment, and thank you for staying, because there's so much going on in Hudson County, and again, it's just incredible that all this is actually happening right here in Hudson County. Now, you were talking to us and explained to us what TAVRs were and so on and so forth, but how does a patient actually get to the TAVR? Now, what is aortic stenosis? What is the implication? Because for me, as an internal medicine doctor, for example, I typically will hear a heart murmur or something like that. But again, there's typically more than a heart murmur. There's signs, there's symptoms, and so on and so forth. Can you elaborate? How does this all start?
Great question, Angel. I think I want to actually communicate to Hudson County population. Anybody like above 65, if you feel shortness of breath, if you feel chest tightness when you're walking, if you feel dizzy, or if you're passing out, it could be aortic stenosis. Please do not neglect. Go to your doctor, primary doctor, or if you have a cardiologist, go to them. Let them examine. If the aortic stenosis, this problem can be completely treated, and you're saved from all these symptoms, but also from mortality. So symptoms. Some people may not have symptoms, very rare, but in that case, when they are frequently visiting the primary doctor, they can hear a murmur. I think I also want to communicate to all the doctors in the community. If you hear a murmur, sometimes murmur may not say how severe the valve is. Please refer them to a cardiologist. Also, order an echocardiogram that will tell you what's going on with the patient. Very rarely in younger patients also we can see aortic stenosis, particularly if they have some congenital abnormalities like a bicuspid valve, or if they had suffered from infection like rheumatic heart disease. But when you have symptoms, please do not neglect, go to your doctors, because that could be life-saving.
Absolutely. I think just telling people not to neglect their symptoms, go see their doctors, that's been such a trend for us. But you know, we're all doctors, so there's a lot of doctors speak. So I just want to be clear that if you feel like you're short of breath, you're walking around and you can't catch your breath, go see your doctor. Yeah. Go see your doctor. I think it's important. And you told people about this test called an echocardiogram. You want to tell them more about it?
Yeah, echocardiogram is a ultrasound test, and it's done within like 15 to 20 minutes. And we put a gel. It's not a painful procedure. You don't need to worry. Go to your doctors. Yes. They put a small gel like an ultrasound. They take the pictures and they get to know about your heart, how the heart is working, how the valves are. This is a very good test, and without pain you get the results of your heart. Then basing upon that, doctors will make a decision what needs to be done next.
So I was very impressed with what you said, and for a lot of us, even when we trained, the TAVR procedure was not available. So here you are, you're describing this game-changing procedure really for our community. What are other advantages of it, and who is the ideal candidate?
Excellent, great question. The greatest advantage, we are getting the same results like open heart surgery within 1 hour, no general anesthesia required, no open heart, and you go back to your work, whatever work you are doing. It could be a desk job or it could be a physical job, and you will be able to do that. Anybody above 65, if you have a valve problem, I think you are a good candidate. You don't need to undergo open heart surgery. But for a younger patient, what happens if somebody comes to us like a 40-year-old because of rheumatic fever, they have a valve problem? We don't do TAVR for those patients because what happens is these valves do not last lifelong. Right? So for them, we give what's called mechanical valve. Right now, we don't have a technology. We don't know. It may come up in the future. We put a metal valve. Metal valve lasts lifelong. But you know, metal valve has a lot of inconvenience. You have to be on the blood thinners. But that's why we are trying to avoid metal valves once you reach 60 and 65. Because even whatever the valve we give, if it gets degenerated in the future, we can put another valve. No, same technique. So everybody above 65, FDA has approved, you can go for the valve procedure.
Now, Mike, we only got about a minute left, but explain to us, for example, like the criteria. In other words, the evaluations, because again, you guys have an incredible program. I would assume that you've actually had patients that have actually been evaluated and actually rejected by other programs. Have you had those patients that actually came to the medical center?
I'm very proud. Actually, we had 2 patients. You know, sometimes what happens is, even though TAVR is a less risky procedure, sometimes we are worried. There are some features. There's particularly one patient, he had a condition called bicuspid aortic valve. It had a lot of calcium. And his heart is very weak. And he's a younger patient. We referred him to go for open heart surgery. But surgeons were afraid because he was so frail. They thought he's not going to make it through the surgery. And he went for a TAVR evaluation in a different center. But his calcium is so bad, they were worried that during the procedure he may get into complications. They basically said palliative therapy. You know, the patient came to us, we understood the risks, and we explained to the patient, you know, it's not always, may not go 100% right, but we can attempt this for you, provided you are ready for the risk. And we agreed, and we were able to successfully do a TAVR for him. Now he's doing great, and you know, that's there's also another patient who is like a 95-year-old. But by the way, age is not the cutoff. Even if you are 100, if you are reasonably healthy, walking around, we can do the TAVR. So this is designed for patients, however old you are, even 102, you are reasonably healthy, not bedridden, we can do a TAVR.
What great story. So amazing for our population. Great to have you. Thank you all. And we'll end this segment. Thank you so much for coming.
Thank you, Dr. Akunyili. Thank you, Angela. Appreciate it.
And thank you, everyone, for joining us, and we will be back with you next week. Thank you very much.